sustainable health solutions for human resources for health, for health service delivery, and a new area which we are venturing in, which is actually health financing.
I'll be coming to that. Actually, you want to tackle one thing that really is so close to my heart, and of course that is health insurance. We'll be talking about that. But of course, you've been in existence in Uganda for 30 years, but also in Africa for 60 years. That's something very, very great. But how have you contributed to, improvement of the health sector in the country? How do you partner with government?
So our main approach to our health interventions is actually health system strengthening. Our expertise is in training human resources for health, and many people in Uganda, many health workers will attest that at least they've had a training from Amref. We strengthen service delivery. Many health facilities in this country will testify that we will improve service delivery through supporting local governments, the Ministry of Health, in doing support supervision, enacting favorable policies, improving quality of healthcare at frontline level. We have done a lot of work in making available community health workers who touch the disadvantaged populations at the frontline. There's a lot of health infrastructure we've developed, many labs, many water points. We have about a 700 million investment in Kitugum, which is a fecal sludge drying bed, which is going to support the Kitugum municipality district and the surrounding districts to treat fecal waste. We've built more than 10,000 water points in schools, in hospitals, in communities, and by that we are really directly touching the lives of people.
Now let's look at universal healthcare. You've just been telling us about the areas where you have really, you have a footprint, and it's good that we hear you are mostly in those rural districts and areas of the country. Universal healthcare. This is something that most people actually, don't even understand, don't even access. How do you do it as Amref?
So I'd like to first of all paint a picture about universal healthcare. So imagine a world where you want a health worker and you can find one with ease. You want treatment for a certain ailment and you can find it with ease. And even if it was at a cost, it's at a cost that you can afford. And this would be to be everywhere. That, in simple terms, is what universal healthcare is about. So our aim is to increase the number and skills of health workers, both the conventional health worker and the community health workers. Currently, we are working together with government, not just to build the capacity of village health teams, but also to develop and scale up the new cadre of community health extension workers. We work in developing health infrastructure, but most importantly, for us, our focus is going to be reaching the person at the last mile. And we do not have enough conventional health workers, nurses, midwives, doctors to do that so far. And I think it will take us many years to do that. But I think if we invest in community health workers, we are going to be able to do that. The other thing we think about is increasing investment in health.
Yes.
But most importantly, protecting the frontline person from financially catastrophic events, which means that if somebody has to wake up at night, get an ambulance, go to a health facility, see a doctor, get treatment for about a month, that should not make them sell their property, their cows and goats and so on. To access
those services.
In other words, we want to strongly support the issue of the National Health Insurance Scheme.
Actually, now that you have tackled it, yes, it is something that government up to till today, it has failed to to come up with. The other time we were with the Minister Opendi, and she just told us, yes, they are working on it. But this is something that other countries within, other governments within the region have actually, they have done it. I'll give an example. Rwanda just recently came out of that horrible genocide. But today, even the person in the most remote area of the country can access free medical health. Your role?
Amref continues to advocate that we have a national health insurance scheme, but we also must have it when we are ready. We don't just start up one morning and say people pay premiums and this is how the service is going to be developed. You need legislation, you need guidelines, you need to train people, you need to know how to pay, collect the premiums. You need to be able to see how these premiums translate into service delivery. You need to be able to monitor to see that are we getting a return on investment. And so government must be prepared. And so does the community and those all stakeholders who are going to be involved. Now, as Amref, we have experience in introducing, scaling up, explaining to communities what such a scheme would look like. We are helping Kenya, for example, to scale up the National Health Insurance Scheme.
They already have one.
They already have one, but we are trying to scale up so that we get the coverage, the universal coverage of national health insurance, like we've just been discussing. So this is an experience that we can bring to Uganda and any other country where we operate.
And finally, Doctor, of course, December is a day that is a month where we look at combating the spread of HIV/AIDS. And Amref, as you've just said, you're so much into the health sector. How do you tackle this one? Do you have a specific maybe department that specifically looks at that? And how do you partner with the government to deal with this?
First of all, I like to say that Uganda is one of the countries that has done very well in managing the HIV/AIDS pandemic, reducing prevalence from about 30% in the 80s to about 6% now. However, we still have teething problems. For example, while we have HIV prevalence of about 6%, we have a teenage pregnancy of about 25%. Now, the route through which you get pregnant as a teenager is the same route through which you get AIDS. HIV. So the risk is still very, very, very high. So we must focus on prevention, because even there are large numbers of treatment, numbers of people on treatment. Unfortunately, we cannot get all of them. Only about 70% of the people who have HIV are actually on treatment. So there's even a problem of finding the other hidden 30% who we need to find. So we need a concerted effort to ensure that the generation that is coming at least has zero HIV infection. So as Amref, we work with government to achieve that. We especially focus on prevention. We have other programs that even deal with treatment, try to prevent, for example, children being born from getting HIV. And if they're born to mothers or parents who have HIV, then we are very engaged in eliminating mother-to-child or parent-to-child transmission, if you may.
Thank you so much, Doctor. And of course, we will finally come to this interview. But tell us, where are you going to celebrate the 30 years of existence in Uganda?
We have an event at Sheraton Hotel, starting in the afternoon, and be there with several stakeholders. But most importantly, to celebrate with us, think about how you can create a lasting health change in Africa and in Uganda. And if you can do anything about that, you're celebrating with Amref at 30 and Amref at 60 years. Thank you so much, Dr. Patrick Kagurusi. That has been Dr. Patrick Kagurusi, who is the head of program, but also Deputy Director, Amref Health Uganda. And we've been discussing generally universal healthcare, how people can access these things. We've come to the end of our lunchtime news this Tuesday, the 6th day of November 2018. Thank you so much for having been part of this. My name is Edward Rukidi Kijanangoma. Stay tuned, do not go away, because there's so much more that's coming your way. Bye. Thank you. Thank you. UBC Radio 98 FM.
Moru dus UBC Radio.
Maru UBC Radio.
Programs me Sunday. Radio me UBC.
Apoyo.
Your programs are so informative. I love them so much.
Your music rocks me.
Nyumira nnyo kuwuliriza UBC Radio kubanga abantu bayo bakola ekiriyo.
You are listening to UBC Radio.
UBC Radio broadcast throughout Uganda and beyond. Start your day with the